Hello everyone, Jeff Clive here, presenting my case, a retreat on the lower left side. Enjoy! And you can see I've used a round diamond burr to start my access. This is different from my normal access. Usually in regular dentin, I will be using a chamfered diamond burr. And that's generally my go-to burr. I'll also use it if I'm doing porcelain fused to metal crowns. I'll use the diamond chamfer burr through the porcelain, and then I would change generally to a carbide burr. In this case, I've started off using that round burr, and now I've switched to a carbide burr, and I'm using that to refine my access to make kind of a nice trapezoidal shape. And in retreats, it's the thing that can be difficult is often when we're working on canals that haven't been treated, there's no buildup and you drop into the chamber. Whereas with retreatments, there's usually not a drop. So if you're not careful, you could inadvertently drill into a furcation because you don't feel yourself drop into any type of chamber. So it's important to periodically take a look, and you can always take measurements off of the radiograph before you pick up the drill. And often I will do that in a retreatment just to get a gauge off of how deep I plan to be, and then I kind of eyeball it. So the first step I usually take when I'm doing a retreat is I'll get a gates. In this case I grabbed one that was too big, so ended up drying it out and searching for smaller gates to use. Gates are generally the first instrument that I use. In this case it came in the kit and it was bent, so I had to go get a new one. But it's important that they're straight. I like to start with the short gates, and I'll use that to get out probably the coronal third, sometimes the middle third of GuttaCore. And so here I am looking for a burr. Sorry, I'm trying to find it, looking around. So I can see there's two mesial canals, and there's the distal canal. And at this point, there's a chance that the distal could still split as we go apically. And in this case, we'll see that it actually will. I'll find out as I'm using some hand files. So now that I kind of know what positions to go in, what angles to use my gates, I'm ready. And often I'll start with the 3 gates. In this case, I started with the 2 gates, so there it is. And just go in there a bit. You'll see me kind of dimpling first, making sure my angle's correct, and then going further down. Gates generally do a pretty efficient job of removing the GuttaCore. In this case, I wasn't sure exactly what type of obturating material was used, whether it was straight GuttaCore or whether it was perhaps a thermophil, or in this case happened to be GuttaCore, which is a cross-link GuttaCore that really doesn't behave the same as regular GuttaCore. So it doesn't dissolve in solvents that we use, which typically the solvent of choice is chloroform, because it dissolves, of course, GuttaCore and some other filling materials. So I've also decided to switch here to an XP shaper. You can see it's kind of shaped like a snake. And as I go into the canals, I actually run it really fast at about 3,000 RPM, which is much faster than my typical rotary. Typically with my rotary, I'm running at about 500 RPMs. This one I run quite a bit faster, and it actually has pretty good cyclic fatigue in that you're not likely to break it unless you're pushing too hard. But it does a good job with the snake shape that it has of rubbing against the walls and cleaning out old GuttaCore material. As you see, a lot of flakes kind of coming outside that tooth, nestled along that rubber dam frame. And it's important to use pretty regular irrigation. In our case, we're using a sodium hypochlorite solution, and you'll see me periodically use this. It's important to have a good assistant who's able to suction up excess, and as you can see, she's using kind of an endo tip. So I've worked on the distal with that XP shaper. Now I'm going towards the mesiobuccal, mesiolingual, trying to get my angles right, running it quickly. This GuttaCore is because it's used in a GuttaCore, it tends to be a little bit more, the properties that it has are a little different than typical gutta percha. It tends to be more creamy, and that makes it more difficult to remove because it doesn't stick together as much. It kind of comes out in bits. And the GuttaCore, I also don't like as much as the regular thermofill carrier as far as retreating it, because it also breaks up, and you often will get out a piece at a time. And so here I've switched at this point to a larger size regular Vortex blue file, kind of a standard taper. I'm just trying to rub against the walls. As you see, I come out of the canals, I kind of angle my file such that it's kind of rubbing against the walls. And I'll turn it so that if it's a mesiobuccal canal, for instance, it'll brush up against the mesiobuccal line angle. And if it's the distal, I'll sweep both buccal and link, because that tends to be where the gutta percha accumulates, because that root is not round in cross section. It actually turns to be ovoid. And what you saw me do there is use an ultrasonic. Ultrasonic they're really great instruments. What I like about them is you're able to see what you're doing when you use them for the most part. So at this point I'm trying to remove some gutta percha that I've been unsuccessful getting out just with a file kind of pulling out at an angle. So I'll be rinsing again with hypochlorite, try and get out some of the excess while there's some active suction. And you'll note that the mirror that I'm using is a small mirror. That is on purpose. I find that the small mirror is actually quite effective at getting back posteriorly when there's not a lot of space. In this case, this patient had a difficult time staying open for long. As you can see, he needs to take periodic breaks. Probably 90% of the time I'll be using a bite block, and in this case the patient gagged severely, so I decided not to. Here I'm grabbing a hand file and using it in the distal canal. This case it's a 30 Hedstrom file, and these files are good because they have the ability to rasp really well against the side walls based on their cross section. They're really good at cleaning out retreatments. Often I'll use the gates, and then I'll go to a Hedstrom and try and engage the gutta percha apical to where I've removed material with the gates, and then I'll get a Hedstrom engaged there and pluck at it to try and pull out what's left. Sometimes it works, sometimes it doesn't, and I have to continue or use a rotary to do that. In this case, based off of that, the thermoplastic nature of the gutta percha in the GuttaCore, not very successful using the Hedstrom files. And often with the thermofill carrier, what you'll do is you'll put several files in at the same time, and then you'll twist them around in a braid to try and grab the GuttaCore. In this case, right now I'm using an ultrasonic, and I'm trying to get below where the GuttaCore is engaged to kind of loosen it. And in this case, I'm not very successful. Unfortunately, that GuttaCore is so flexible, ultrasonic energy doesn't have a lot of effect on it. So, kind of a typical case with maybe a separated file, that would work quite well. In this case, I gave up pretty early because I didn't see much progress was happening. And now I'm using a traditional 10 file, just trying to get to patency on, in this case, my mesiobuccal canal. And I like to use a watch wind technique. I'm also feeling for any apical gutta percha to try and engage and try and pull out. But for the most part, I'm just trying to make sure I can reestablish patency. Now, it can be argued how important is patency needed on retreats. And we always try to get patency when possible. Sometimes it's not possible. Usually the prognosis, I would say, could still be good on a case you don't get patent in, but probably a little bit generally more guarded. Now you see me using a rotary. This is the first time in this tooth that I've placed a solvent, which in this case was chloroform. My traditional rotary that I use, I don't use anything small with retreats. You'll find small files break in retreats. So kind of my smallest file I'll use as a rotary inside a retreatment is going to be an F1. And so that's what this is. This is the Pro Taper Gold Wave 1 file. I rotate it at 500, and then again, this is some chloroform. It's important to have suction, and the rubber dam that I'm using is not a normal latex rubber dam. It is actually chloroform resistant. So that's important. Otherwise, using chloroform, and if it gets past the tooth, outside the tooth onto the dam, it will be able to dissolve a hole through it. And at this point I have to apologize because my mirror is, as you can see, it's wounded. It's got a lot of spray from me working on the tooth, so I apologize that it's not the most optimal of viewing conditions there. Sometimes I'll use the mirror, as you saw there, I'll use it to aid in getting the tip of the syringe into the canal, as you see. And usually it's for the mesial canals. It's either going to be for the mandibular mesials or it'll be for the mesial buccal when we're talking about upper molars. And you can see kind of some of the particles coming out. That was part of the carrier, part of the GuttaCore carrier coming out. In this case I did use more chloroform than typical. Usually I only use about 1 cc or 1 milliliter. In this case I ended up using about 2.5 or so. And most all of it gets suctioned up, but it's something you don't want to use too much. The problem with using too much chloroform is that it can cause, as it evaporates, it can cause a film of gutta percha to develop on the tooth. So there are the x-rays. Previously was the pre-op x-ray, and then you can see the calcium hydroxide x-ray now. You can tell I've removed all the gutta percha on the inside, and looks like we've got a nice dense filled calcium hydroxide placed with an ultracal syringe. Hope you guys enjoyed the video. Have a good rest of your day, and good luck cleaning roots.